Good afternoon, everyone. Thank you for joining us here at the Being of Homelessness and Housing Initiative for our webinar series. We'll begin shortly. I'm going to give folks a little bit more time to log on, but happy to see so many folks already here. All right, let's go ahead and get started. As I mentioned, my name is Mark Jones. I am the Policy Director at the Being Up Homelessness and Housing Initiative, or BHHI. Welcome to our webinar on Latine experiences of homelessness. I'm really honored that so many folks have taken time out of their days to engage with this really important topic. Our webinar today will last until 1 p.m. and will consist of a presentation portion led by Marco Cushel, our director, who will walk through our findings along with my colleague Zena and my colleague Michelle. After that, we'll move to a roundtable portion of the discussion and then have quite a bit of time for audience Q&A. So if you are listening along and have a question, please feel free to use the Q&A option to let us know what you would like the panelists to talk about. Um, the webinar today is being recorded and will be archived on our website and up for folks probably within the next 2 weeks. Again, want to shout out that Q&A box. So if you've got a burning question that you've already walked in the door with, the virtual door, please feel free to put that in now, and we'll make sure that we get to it when we get to our Q&A portion. A little bit of context setting for the day. 35% of California's population experiencing homelessness identifies as Latine. Their pathways into and through homelessness in many ways are similar to all Californians experiencing homelessness, but have some distinct features shaped by systemic discrimination and racism, exclusion from safety net programs, and a lack of culturally responsive services. I do want to just lift up before we begin today that as we approached this work, we made an intentional decision not to ask folks about their documentation status. And as a result, today we're not really going to be focused on documentation status or broader questions around immigration policy that impact this community. I will make a specific sort of broader equity note that immigration policies impact every community. And it is, in fact, part of our internal bias that we overly ascribe impact to a singular community. And so today, what we're really going to be focused on is the homelessness response system and how it can better respond to the needs of Latino Californians and folks across the country. But we're not going to go into some of those specific immigration dynamics. Our focus in our research and in today's conversation is on homelessness. And we hope that by building bodies of evidence, we can ensure that everyone has a safe and stable place to live. We would ask that we stay grounded today in that knowledge. Um, we are going to put into the chat a link to the report, but also on your screens right now, if your phone is there and handy, I believe, is a QR code. We encourage folks to engage with the entirety of the report. It's very comprehensive. Um, with that said, our agenda for the day, we're concluding the opening remarks portion. That's me. And then we will move forward into our findings and policy recommendations and then audience Q&A. I'd like to invite the panelists to join me on screen so I can introduce folks briefly, and then we'll get started. So Margot Cushell, the person who I have the privilege of calling my boss, is a professor of medicine at UCSF and the director of BHHI. She's the principal investigator on the California statewide study of people experiencing homelessness, or CASPEH, and her research for many, many years has focused on elucidating the causes and consequences of homelessness, and developing evidence-based strategies to prevent and end homelessness. Zena Coronado is a qualitative research project manager at UCSF BHHI, and she served as the qualitative project manager on the CASPA study. At the end of this month, super excited. Zena will be leaving us. I'm not excited about that, but I am excited that she's leaving to pursue a PhD in behavioral and community health at the University of Maryland. And her research does and will explore how shifts in public policy impact substance use patterns and overdose vulnerability for Black and Latinx populations in urban contexts. Michelle Cox is a housing technician for the city of Roseville, California, where she connects people to housing and resources. She experienced homelessness on and off from ages 14 to 30. And Michelle is an active member of the Future of the Coordinated Entry System board and has volunteered with a point in time count in her community. And Melissa Chinchilla is a health services researcher whose work explores the intersections of homelessness, health equity, and structural racism with a focus on veteran and Latinx communities. She serves as a project scientist at the David Geffen School of Medicine at UCLA. And Dr. Chinchilla co-chairs the task force on Latinx people experiencing homelessness and previously served as a mayoral appointee to the Los Angeles Homeless Services Authority, or LAHSA Commission. You can learn more about our panelists and their work via links that are in the chat. But at this point, I would invite everyone other than Margot to turn off their cameras, and I'm going to turn it over to Margot to lead us through what the CASPA data says about this important community. Thanks again for joining us, everyone.
Thank you so much, Mark, and thank you everyone for joining us today to talk about this critically important population. I want to ground everyone with some background of how we got here. The story of the structural drivers of homelessness for the Latine community go way back. We're talking about the historic land displacement. Of course, California initially was part of Mexico, and there was historic land displacement with the Treaty of Guadalupe Hidalgo. This set the stage for there to be, America's sort of terrible history of segregation and redlining, where communities of color, including the Latine community, were not allowed to live in certain places leading to segregated communities. Of course, although it was immoral and unethical, it was perfectly legal during this time for things like people to not be able to sell land to people who are not white, and for banks, for instance, to not offer mortgages to people who were living in the communities where people of color were allowed to live. This segregation and redlining was no longer legal after the Fair Housing Acts of 1960s, but if you were to come down from Mars today, you could still see where those red lines exist because the truth is we still live in those segregated neighborhoods. The displacement and the lack of ability to, for instance, enter housing markets in the post-World War II boom in housing has enormous responsibility for the enormous wealth gap between white communities who were allowed to build wealth through housing and the communities of color who were not. It also led to the lack of home ownership possibilities. There are many other structural drivers that really shape the experience of Latine homelessness. The lack of safety net access for mixed status households or households where some members have the privilege of citizenship or legal status in the US and others don't. There are ongoing educational and employment barriers. And of course, with the rising costs of housing hitting low income communities the hardest, there is severe housing cost burdens, which really help drive the crisis of current homelessness trends. So, what did we learn during the California statewide study of people experiencing homelessness, which was a representative study of adults experiencing homelessness in California? We learned that 35% of adults experiencing homelessness in California identified as Latine, and 14% of whom, so 14% of that 35%, elected to take the survey in Spanish. We found that compared to other homeless adults, Latine adults were significantly younger than other adults experiencing homelessness, with a median age of 42 as compared to a median age of 47 in the overall population. The vast majority of Latine adults experiencing homelessness were between the ages of 25 and 49, or 62% were. This is a much higher percentage than we saw in other populations. Like other populations, most members were cisgender men. 68% of the Latine homeless adults were, 31% were cisgender women, and 1% identified as transgender, non-binary, or other gender identified. We found that among Latine adults experiencing homelessness, 85% of it is what we call single homeless adults. That really means that you are over the age of 25 and you are not currently living with minor children. 12% identified as adults in homeless family. These were adults living with minor children. But very importantly, a third of those who did not count as being an adult in homeless family actually had minor children who were not living with them at the time. 3% of Latine adults were counted as transition age young adults between 18 and 24. And I will mention our disclaimer that this is a very different population that is hard to sample, was not actually the main focus of ours, and we are not making any statements about the number of transition age young adults. 24% of Latine adults experiencing homelessness were born outside the United States. This is a significantly higher proportion than other racial groups in our study. I want to reiterate what Mark Jones said just before, that we did not, in this study, ask people about their documentation status. We made this decision because we were fearful of legal implications and trust. Some of the participants opened up and talked about their documentation status in the in-depth interviews. What we can say is that obviously anyone born in the United States has legal status. We suspect that a high proportion of the 24% of Latine adults who are born outside the US did have legal status, but we don't have the exact numbers. Latine people experiencing homeless in California are Californians. Like the other proportions, 93%, this is actually a little higher than other racial groups, but similar, 93% of Latinx Californians who are experiencing homelessness in California lost their last stable housing in California. Once again, Latinx folks who experience homelessness in California were housed in California prior to becoming homeless. In fact, 78% were last housed in their current county. 78% had not moved counties when they became homeless from when they were housed. 48% of Latinx Californians were in their very first episode of homelessness. This is a higher proportion than we saw in other racial groups. This was even higher among those who took the survey in Spanish. 71% of those who took the survey in Spanish were in their very first episode of homelessness. Latinx Californians who took this study elected to in English, 44% were in their first episode. So where were Latinx Californians prior to homelessness? We mentioned that the vast majority were living in California. Over half, or 52%, were living in what we call non-leaseholding arrangements. These were people who were housed in the community, but living with family or friends who did not, and they did not hold any legal rights to that housing. What this means that something like eviction prevention would not have directly protected them. It might have protected them previously, but they were not people who held tenancy rights. 29% were in housing for which they had legal rights. We called these leaseholding arrangements. So these were renters or in some cases owners of housing. 19% came directly from institutional settings. This was driven primarily by prison and long-term jail stays, but also included things like drug treatment centers. The cause of homelessness really is the vast disconnect between housing costs and income. Among Latinx Californians experiencing homelessness, the median monthly household income in the 6 months prior to losing their housing was $1,000. Among non-leaseholders, the median monthly household income was $950. The median monthly housing costs among those who paid rent was $200. Among leaseholders, the median monthly income was $2,000 and the median monthly housing costs were $600. $600 is in fact below, is it, 30% of $2,000, which is usually thought to be the affordability index. But the problem is once people lost housing in California, they could not get back into the housing market for as low as $600 a month. Latinx Californians had a distinctly short time period of warning prior to losing their housing and becoming homeless. The median warning across all Latinx Californians was 2 days. This is quite a bit lower than the already short median notice among all Californians experiencing homelessness, which was 7 days. Non-leaseholders had a median warning of only 1 day, meaning when things fell apart, they fell apart quickly. Leaseholders had only 3 days warning. I want to make the point that California has relatively strong rental rights laws. In general, most people need to get 30 to 90 days of warning prior to losing their housing. The only people who have legal rights for only 3 days are in a situation called pay or quit if people have had warning for months that they're behind in their rent or mortgage. We think that this might reflect the very strong lack of connection to legal support or sense of agency that they could exercise their legal rights to housing. Only 31% of Californians who became homeless had reached out for any help prior to losing their housing. But among the Latine community, as true among the overall homelessness community, they mostly reached out to people in their social network or family or friends. Very, very few reached out for any support from government agencies or nonprofits or groups outside their own social network. People experiencing homelessness who were Latine in in-depth interviews really spoke about the strong importance of receiving support from familial and social networks. Latine adults experiencing homelessness strongly relied on social network for housing, financial, and other forms of support. However, this support was not enough to stave off homelessness, but it did delay or interrupt periods of homelessness. So we saw a lot of people in the Latine community having very fluid experiences of homelessness, spells of homelessness interrupted by short stays with family or friends in something called couch surfing, and then returns to homelessness. We found very much that feelings of shame kept some from seeking help from their social network. They spoke about the culturally prescribed values relating to stoicism and self-reliance, led some to not feel like they could reach out to family or friends or other possible forms of support.
I'm very closed about what I'm going through. None of my family knows I'm homeless, none of my friends. I just don't want to tell anybody. I want to be able to get out of this alone. It feels like I'm stuck in this and it sucks.
Michelle. So when Latine adults experienced homelessness, where did they experience it? We found that the vast majority were not in shelters. 54% of all Latine adults experiencing homelessness in California had spent the majority of their time in the prior 6 months outdoors, often in settings much like the one in this beautiful photo, really heartbreaking photo by Barbara Reese. 26% had spent the majority of their lives in an unsheltered setting, but living in a vehicle. Only 21% spent the majority of their nights in the prior 6 months in shelters. As I mentioned, we saw this fluidity between housing status, people in the Latine community transitioning between temporary stays with family or friends, homeless shelters, and a variety of unsheltered settings. But what they noted in in-depth interviews that their stays with family and friends were marked by overcrowded, chaotic, and substandard conditions. Michelle, can you turn your
Sorry about that.
voice?
I ask if there is an available place for renting. If everything is occupied, you look for cars to sleep in and ask the owners to let you sleep in one for one night or so. They let you stay one night or something like that, and the next morning you must leave. You can't stay any longer because they don't want you there. So you leave and you look for another place.
Once people experienced homelessness, everything else fell apart. 48% reported fair or poor health. This is a well-known question that's used often to predict things like future hospitalization or even mortality. I want to point out that this was a relatively young population. Even in an old population, the statistic would be staggering. But considering how young the Latine population was, this really points to the lack of availability of health, the stresses of homelessness, the difficulty receiving healthcare services, and the toll that homelessness takes on people's bodies. 63% of Latine Californians reported experiencing mental health symptoms in the prior month. Most commonly, though, these were symptoms of depression and anxiety. 5% of Latine Californians reported experiencing a psychiatric hospitalization in the prior 6 months. This is the same as the population overall. And as a marker of a more severe psychiatric condition, 11% of Latine Californians reported having experienced hallucinations in the prior month. 35% of Latine Californians reported regular, meaning 3 times a week or more, use of illicit drugs. Like the general homeless population, this was driven primarily by methamphetamines, where 33% reported regular use. 11% reported regular use of non-prescribed opiates like fentanyl or heroin. These were mostly used in conjunction with methamphetamines. Very, very few reported only methamphetamines, only non-prescribed opioids and not also methamphetamines. Only 1% of Latine Californians reported regular use of cocaine. 11% reported heavy drinking weekly, at least weekly or more often. This was 6 or more drinks in one setting, at least once a week. We found, like in the general homeless population, that complex behavioral health needs were common. 51% of Latine Californians reported either regular illicit drug use, heavy episodic alcohol use at least weekly, a recent psychiatric hospitalization, or hallucinations. We think that this population is the population who could most benefit from housing plus robust support services, as opposed to just housing with light touch or no services. I want to point out that when you do cross-sectional studies like this, you overrepresent people caught in chronic homelessness. So this is not a statement of the number of people who experience homelessness over time, but people who are homeless at any one point in the Latine population. Now I turn it over to my colleague, Zena.
Thank you, Margot. Forced displacements, also known as sweeps, and interactions with the police were common for Latine adults experiencing homelessness. 35% had their belongings taken by the police or government workers in a forced displacement. 45% reported being roughed up by the police during this episode of homelessness. Just a reminder to place any questions that you have in the Q&A. Experiences of violence were extremely common. 37% of Latine adults reported experiencing physical or sexual violence during this episode of homelessness. 37% reported experiencing physical violence, and 13% reported experiencing sexual violence. Discrimination was common. 81% of Latine Californians reported experiencing discrimination in their daily lives. Latine Californians reported having experienced discrimination based on their ethnic identity when seeking either housing or services. They reported experiencing increased police harassment because of their Latine identity. And these experiences of discrimination discouraged them from seeking services. Michelle?
I am sorry. I think race has to do with it a little bit. My name says it all. I'm blank Hernandez. That name is so common that that's another Mexican. Let's put them at the end of the line again. That's the type of treatment that I've been getting. Everywhere I go, I'm like, I'm going to go change my name. Maybe, Smith. It's getting to me where I don't even try anymore because it's repetitive.
We found differences between Latine Californians based on whether they were born in the United States or born outside of it. Latine Californians who were born outside of the United States, compared to Latine Californians born inside the United States, were more likely to be an adult in a homeless family as compared to a single homeless adult. more likely to be in their first episode of homelessness at the time of the interview, and to have entered homelessness from a non-leaseholder housing situation compared to having been a leaseholder immediately prior to homelessness. Latina Californians who were born outside the United States were less likely to report having health insurance, having mental health symptoms, having experienced a jail stay during this episode of homelessness, or receiving assistance from a case manager or housing navigator. Latina Californians reported multiple barriers to regaining housing. As with other groups, the most common barrier was simply the high cost of housing. 91% of Latina Californians noted this was a major barrier. Latina Californians noted other barriers which were significantly more common among Latina Californians than members of other groups. 62% noted that they lacked documents. By this, they meant things like identification or proof of income. 60% noted that not receiving help from a case manager or housing navigator impeded their access to housing. And 46% reported that experiencing discrimination in housing searches was a barrier to their regaining housing and exiting homelessness. In in-depth interviews, several themes surrounding the barriers that Latina Californians face in returning to housing. Um, there were challenges navigating online application, limited English language skills, lack of documentation or citizenship status impeded access to benefits, and then a large disconnect between income and housing costs.
I mean, the biggest thing is just like the pay that everybody gets is just, it's not possible to live off of. I mean, for me personally, I have about $10,000 in savings, which could pay for first, last rent, and then the deposit. But my monthly income is not enough to maintain a one-bedroom apartment, often not even enough to maintain a studio.
Based on these findings, we have several policy recommendations. First, homeless serving organizations should partner with Latina serving community-based organizations to expand homelessness prevention, housing assistance coupled with workforce development, legal assistance, and anti-discrimination efforts, housing and services for homelessness families, and support services for children. And then lastly, access to family reunification services. We also recommend expanding culturally tailored programs for Latina populations, including case management, peer navigations, and peer support. These could be done using Medicaid 1115 waiver programs, behavioral and physical health services everywhere along the housing journey, including street outreach, shelters, and housing. Efforts to expand Medicaid enrollment and provide the full spectrum of reproductive health services and provide services for survivors of violence. Government should also work to expand culturally and linguistically appropriate substance use treatment, harm reduction services, and mental health services. As I invite the other panelists to join us for our roundtable and Q&A, please remember to put your questions in the Q&A box. I encourage you to follow us on social media and download the report.
Thank you to our panelists. I'm already seeing a number of audience questions come in. So just a reminder to folks, please do use that Q&A. We will get to your questions shortly. But I did want to start with a couple questions that came up for me as I was sort of listening to the panel, sort of, you know, moderator's privilege. Michelle, I know that you've supported the point in time count in your community. And I'm curious if you could talk a little bit about what do those counts capture and what do they miss, particularly when it comes to this community.
Yeah, thank you. Thank you, Mark, for asking. So I did do the pit count this year where I reside. It was an amazing and humbling experience. I was able to connect with the community and hand out resources and tell my story a bit to the unhoused and be part of the outreach programs. So during the pick count, we captured a snapshot of homelessness in our community, including the Latine population. We were able to see visibly homelessness, focusing on those that are in shelters and those that are in unsheltered spaces. Captured the basic needs, that the basic services that are needed with, and this drives the programs that are offered in our community, and it steers funding and assists the community. The pick count tends to miss some things also, the actual count of the Latine community that are experiencing homelessness, because we don't see the families that are doubled up with family and friends. They sometimes have fear of the system's involvement, and sometimes there's a language barrier that creates issues with outreach programs for these individuals.
Thank you. I'm also curious, sort of building off of some of what you saw in the point in time count and some of the work that I know that you do. So a lot of folks in CASPEH were in non-leaseholding positions. And I'm curious, sort of what you think that says about what kind of prevention efforts we need. Sort of particularly thinking like, how do we respond to people, right? And not sort of our ideas of people.
Right, a great question. So in the community that I currently work with many of the Latin participants experiencing homelessness, they did come from non-lease holding situations, such as living with their family and friends. And when I say family, I mean not like immediate family, like they're living with uncles and aunts and cousins, etc. This might feel safer for them. However, that's not always the case. Multi-age environments can cause conflict between members of the household as well, as far as who's playing what role in the household, or having respect for one another. There could be some sort of resolution services for these families. Like I'd suggest classes offered, counseling, some place to go to get resources. More prevention efforts need to be more culturally responsive and proactive when it comes to providing services in a person's preferred language. Also, someone who can recognize the roles of extended families in multi-age living arrangements, maybe partnering with local organizations that are already trusted by the community, like churches or family therapy locations, or having case managers readily available who speak the language and understand the cultural norm, so that people are not afraid to ask for help before a crisis hits.
Thanks, Michelle. That's super helpful. Margot, turning to you, and I'm going to start weaving in some audience questions here as well. You, putting it mildly, have done a lot of research. And you served as the PI for CASPA. And it wasn't an enumeration effort, but you did so much work thinking about like who was going to connect with this population, how to engage folks. And I'm wondering if you can just talk to us a little bit about how that impacted your approaches in designing and implementing the study. And then sort of weaving in some of the audience questions. I'm also wondering if you could talk a little bit about what you saw in terms of, urban versus rural versus suburban, how the study sort of addressed that. Well, let's stop there. It does feel meaty.
Yeah, great question. So we've got lots of details on the methods in the original report, which I encourage everyone to read. We actually have a really geeky, for those of you who like want to replicate this, some methods papers that I'm also happy to share if you don't have access to. But in short, what we were tasked with doing was describing adults experiencing homelessness across the state in a way that would not, for instance, overrepresent those who did or did not use services or overrepresent one population. We weren't tasked with saying this is how many people are experiencing homelessness, but really to give a sense of who was homeless. So to do that, we had to do a lot of work that is often what was frankly quite hard to do. But we learned a lot about, we took the state of California, we divided into 8 sections that are normally used in a lot of policy planning. So there are sort of 8 groups of counties that have similarities. We learned a ton about each of the counties in those, and we basically threw it into a mathematical model and chose one county in each of those regions that put together could describe the state of California, which is an amazingly diverse state. So this included counties that were primarily urban, counties that were primarily rural, counties that were a mix. This included counties that were coastal, counties that were pretty high cost versus low cost. We really got a real mix of those. Within each of those counties, we developed a map of sort of where everyone experiencing homelessness could be, randomly selected from there, and randomly selected the 3,200 people we interviewed. We did a few things to make sure that we did not underrepresent the Latine community, which is often underrepresented in research. One of those things was we worked with our amazing community advisory boards, which included those with lived experience, those with like policy and programmatic experience sort of writ large, and some of those who had boots on the ground in those counties. And we thought about places where Latine communities might be that might be hidden. So, for instance, we worked with the United Farm Workers, developed contacts with them, and used a method it's called respondent-driven sampling, which is a geeky method where you actually find populations that are already hidden. That used sort of trusted relationships to be able to get access to farm workers who themselves might have designated themselves as homeless, like that word might not have meant that, but who met the federal definition. In more urban areas, we use things like day laborer centers where day laborers might congregate. Now, not every day laborer experienced homelessness, but within those centers, we used techniques to figure out who was homeless and took a random sampling of those. So that was one sort of geeky method to get the Latine population. But there was something else that I think was extremely important that we did. Our staff who did this work, who are absolutely heroic, and I want to give a shout out to Zena, who I think spent more time in the field than any other person, really took 13 months of her life traveling around the state, living in motels and otherwise. But we hired a staff, many of whom themselves had lived experience of homelessness, many of whom themselves had lived experience working with people experiencing homelessness. And we also hired people who were not only bilingual, but also bicultural. So that when people approached, let's say, the Latine population, they were often talking to people who shared their both ethnic and linguistic identity. We did the survey in both English and Spanish. For other populations which are smaller, we used interpreters, but we had people who did everything translated in Spanish. So I think both the way we made sure we didn't miss hidden populations, and the fact that when we approach people with people who look like them. Our amazing lived experience advisory board often either came with us into the field or found other people to come with us into the field to go with us and almost give us credibility to say we know these folks and trust them. So those were some of the things that we did. Thank you for that question.
Thanks, Margot. Um, I'm coming back to you, and don't worry. But I do want to pivot to Zena briefly. Margot just mentioned how much time that you spent conducting these interviews. And I'm wondering if you can talk a little bit about the the structural racism and the fear that folks had, right? Especially, maybe in mixed status families, right? Limiting access to stable housing and services, right? So, from your perspective and from what you saw, how does that fluid movement, but sort of between like really bad housing and homelessness and, the blurriness, I guess, right? How does that challenge how we define homelessness and how we engage with folks, and then certainly how we then respond?
Thank you, Mark. So to me, the fluidity really highlights the need for us to expand our definition of homelessness, which right now, as you mentioned, excludes those that are living in overcrowded or doubled up arrangements. And this narrow definition really creates challenges in how we understand the needs of those who are living in highly unstable or substandard conditions, and inevitably people are falling through the cracks. The current definition is too black and white. You're either homeless or you're not. And for many, including the Latina people who experience structural racism or immigration-related barriers, the situation is much more complex and dynamic than that. So I think that we need to expand our definition of homelessness to ensure that the needs of everyone that's living in precarious housing situations are being acknowledged and met.
And thanks for that. And a follow-up that came in from the audience is, sort of, I'm curious when we were engaging with the community, how was the sort of housing for seasonal workers thought of, right? Did you sort of encounter some of those discussions? And if not, right, I'm curious what you would say about, again, like how do we do a little bit better at engaging with folks, right, who might be in that kind of precarious situation?
Yeah, I think Margot kind of touched on this a bit in her response to the last question, but we did seek out to interview people who were in day labor centers or working farm workers, and as she mentioned, not everyone did qualify to be participants in our study. However, that effort I think really allowed us to gain some insight, especially somebody who did the qualitative portion of the study really gain insight into their stories and lived experiences. And so, yes, we did not have such a large proportion of our participants who did identify as people who were day laborers, but in our conversations, there were some differences. I don't know if that answered your question.
I mean, I felt like it answered the question. Thank you. Melissa, I'm going to turn to you. And sort of building off of some of that and pulling in some of your work, we've talked a lot about how folks don't show up in traditional service system models and often don't get counted in official data. I want to ask you about the consequences of that absence, right? So, again, CASP was not an enumeration effort, but can you tell us, like, when we miss people, what happens?
Yeah, yeah, thank you so much for that question. And also, I just want to take a moment to acknowledge how important this study is. This is really exciting to have this type of data at the state level. But yeah, I think as other folks have already mentioned, the Latino community tends to experience homelessness in varying ways. And some of those ways include hidden homelessness. This could be doubled up homelessness, so doubling up because, folks don't have a choice and they can't afford housing otherwise. And we know that folks that are doubled up experiencing homelessness and also folks that might be couch surfing, Margot mentioned in the presentation that sometimes folks will couch surf for a while, stay with family and friends, and then maybe experience street homelessness, then go back to couch surfing and staying with family and friends. So all those folks that are living with other individuals, tapping into their social networks, that would technically meet the definition of people experiencing homelessness are not captured in homeless count, often are not captured, right? So we have that whole population. And then in addition to that, we also have folks that are experiencing other forms of hidden homelessness. So that might mean living in a garage not meant to be lived in, right? So doesn't have insulation, doesn't have running water, doesn't have electricity. We've also, I'll say some of the work that I've done, it's been primarily focused in Los Angeles County, but we've heard differing stories. We've heard some stories of folks even staying overnight at their places of work because they have nowhere to go. So those folks are not going to be captured, right? So there are a variety of reasons why individuals won't show up in the official homeless count numbers. And then, the other thing I want to raise and that you all talked about was the number of folks that are connecting to homeless services. So I believe it was 21% mentioned staying in shelters from the survey that was conducted. And then there was 60% mentioned not getting any services or assistance from case managers. So the other thing we need to think about is folks are not connecting to homeless services, right? When we're thinking about point in time counts, we're usually thinking about unsheltered populations, so those that we can visibly see on the streets. And then we're thinking about sheltered populations, so those that are connected to resources and therefore are being captured in a sheltered count. So if we know that the Latina community is less likely to connect to homeless services, then they're going to be less likely to connect in sheltered counts. And then if we know that a lot of them are experiencing what we would refer to as hidden homelessness, they will not show up in the unsheltered counts. And then to your other point, you asked about the resource allocation question. So, we know that point in time count numbers are often directly tied to the amount of resources that are received in local jurisdictions. Locally in Los Angeles County, I sat through many conversations around where should resources go, and those resources being matched up to where we saw the highest concentrations of people experiencing homelessness per the homeless count. And one of the things that you hear, and one of the things that I've heard locally here in Los Angeles County has been sometimes communities that have a large proportion of people identifying as Latina, they will lack resources when it comes to shelters available or transitional housing options. So I do think we need to start thinking about and talking about how do we approach our assessment of need when we're thinking about number of people experiencing homelessness and how that ties back to resource need. We know that the point in time count has many flaws, and we need to think about alternative strategies for assessing that.
Thank you. I'm seeing a couple audience questions that I want to bundle, and I think come back to you, Zena. Questions about the term Latine and sort of, why that term. I think some folks, it's their first time hearing it. Can you talk a little bit about how folks identified, as you were talking to them, and then also just like sort of how the team sort of arrived at that term for this report?
Yeah, absolutely. So, want to recognize that we know that there have been many debates around what term to use to identify or categorize this population, and we are not making any assertion that we have the right to tell people how to self-identify. We understand that some do not identify with the term Latina specifically, but we chose a term that seemed broad enough to include those who self-identified as Latino, Latina, Latinx, or Latine. And people did identify in all of those different ways in our interviews, and they were asked like to identify if they identified as Latino, Latina. It's all included in the survey when we did the screener with them. So.
Thank you. And then I got a really interesting question here that I think I'm going to send to you, Melissa. So it says, this population is more likely to reach out to non-governmental organizations, their communities, faith-based groups before accessing government resources. This audience member is wondering if there's any data on which government services folks accessed, right? And maybe Margot Rosina, you can chime in on that from a CASPEH perspective. But the underlying question here, which is really interesting to me, is, sort of wondering if folks access legal assistance versus health aid versus state-run services, and right, like what would it make sense for us to increase, right? Like to that question about resource allocation, right? Like where should the next dollar go?
Mhm. Yeah, that's a great question. Unfortunately, I can't quantify like percentage of people that go to the different places that have been named, but I can definitely reaffirm that that is something that we see here in Los Angeles County when we talk to the Latin population experiencing homelessness and ask them where they're seeking resources. So we've seen, in addition to the places that have been mentioned, faith-based organizations, we've also seen community clinics, food banks, like places where people that are low income would go to access resources. One of the challenges is that sometimes these organizations, community-based organizations, don't have the proper information needed to be able to support folks in linking to homeless services. So locally, that's been one of the things that we've been talking about has been how do we start shifting the way that we think about homelessness outreach? A lot of it has been street-based outreach, or some of the things that have happened here locally have been the creation of access centers where folks can go and access resources related to homelessness. But in reality, folks are likely connected already to their community-based institutions, right? They might have trusted places where they go. They might have a doctor that they really have a great relationship with, and the doctors ask them, are you experiencing any housing challenges? Because that's increasingly being asked in a healthcare setting. And so we have to make sure that places that are trusted institutions know how to respond when folks are self-identifying and know how to connect them to the appropriate services. I know Margot mentioned day labor centers and recruiting at day labor centers. Some of the work that we've been talking about locally has been how do we make sure that homeless street outreach staff are working with these organizations? So going to day labor centers and distributing information. I know that there was a question asked about legal aid services. One of the things that we see a lot within the homelessness field has been legal aid services related to housing rights and eviction. If folks have 1 day, 2 days in order to vacate their unit, they're likely not connecting to legal aid services for housing eviction in time for prevention, and they're likely not connecting to it after it being asked to vacate their unit. So we have to think about partnerships between homeless services and legal aid foundations. So that's been something that through my work we've really identified as a key practice has been those partnerships, and not only thinking about legal aid stepping in when it comes to mitigating evictions and helping address like fair housing issues, but also among the Latinx community, helping navigate immigration questions and questions regarding citizenship status among immigrant households and mixed status households as well, because folks might have some confusion regarding what services they may or may not qualify for.
Mhm. I would love to build on that and ask you another question, and then maybe open it up to any panelists who want to add on. But so we know that prevention is key to ending homelessness, right? And you talked about some of the facets of prevention just now, but can you talk like a little bit more about how to ensure that those prevention services, those connections that you talked about between organizations, right? Like, how should folks be thinking about structuring those connections? Like, what are some of the tactical steps that they can take? And sort of relatedly, there's an audience question asking about diversion efforts, right? And is diversion the right way to think about some of those folks who have that 2 days of notice, right? Like, what would that look like for this community?
Yeah. Yeah, thank you for that. I mean, I think that the question of prevention is something that, there's, I feel like we still haven't really developed key models around prevention, at least locally from what I've seen. There's been some movement around developing algorithms that tap into county-based services to better understand who's likely to experience homelessness based on service use and different household characteristics, and then proactively reaching out to those households, which seems to be working very well for folks that are already connected to the system, right? But on that point, one of the things that we've seen with local data, especially specifically mortality data, has been that folks that have passed away and have been identified as people that were experiencing homelessness, a significant proportion of those were not connected to county-based services. And a significant number of those were actually folks that identified as Latine. So if you're not connected to these systems, you will not be identified by these systems, right? So our prevention dollars, one of the ways that it's moved has been through that, predicting who's likely to fall into homelessness. I think you all talked about just the vulnerability that non-leaseholders have, right? So we need to think about prevention services and the role that rights play and having tenant rights and not being a leaseholder, the vulnerability that puts people in. I think other potential key practices for us to continue to explore in the system and how we budget resources and allocate them has been partnerships with local organizations that are trusted advocacy orgs, right? So I've heard there was a pilot done in LA County with prevention dollars that it was a one-time, with everything happening around COVID, it was one-time fund that was given to an immigrant rights organization. And they said that they were able to help the significant number of households with the funding that they received, and they had no problems expending the funds because there was such need among the community. So we need to think about how those prevention dollars are being both funneled into the systems that we know some folks that are highly vulnerable may be accessing, but also folks that are outside the system. So again, those trusted institutions that have relationships with folks that may not be connected otherwise.
Thank you. Speaking of trusted institutions and trying to cram one more question in before I have one last question for the whole panel, but turning to you, Margot, you mentioned the folks' self-reports of their health, and I'm wondering if you could say a little bit about, as a physician, right? If people don't know, Margot's a physician. As a physician and part of one of those trusted institutions, right? That is increasingly engaged in the housing and homelessness space. What health needs stood out, and how are the health experiences, in addition to the housing experiences, shaped by structural racism?
Yeah, great question. And I will just say, I think this issue is very potent now. As Melissa said, if people aren't seeking out care in institutions, we can't find them. And I'm very, very worried about the recent changes that we're seeing a lot of members of the Latine population staying away from health services because of concerns about immigration and other things. Obviously, the recently announced yesterday, California was one of the first states to offer Medicaid to undocumented folks. And now, if you are not on Medicaid by December 31st, you'll no longer be able to sign up for in California. So that's just a backdrop. I would say we are seeing a lot of early onset diabetes, a lot of hypertension, a lot of mental health concerns, and a lot of lack of access to basic health care. So a lot of folks knew that they had diabetes, but weren't able to access services for that. And then a lot of folks we suspect don't know. You can't know you have diabetes or high blood pressure if you're not seeing it. And so I think it's just really important to note this was a younger population, but they were as sick as the overall homeless population, which is much, much, much sicker than the general population. We're really talking about life and death here in a young population of our families, our neighbors, our friends.
Thanks, Margot. Um, well, we are at 101. We've gone a little bit over, but thank you, everyone, for joining us. I do, again, want to thank our panelists for their time and their expertise today. I want to thank, retroactively in perpetuity, the, CASPEH study participants who, contributed their lives and their knowledge to making it possible for us to be here today. And I just want to lift up that we, again, as a team, are so grateful to be here and to be able to speak on behalf of folks who are not here today to share their voices. This work, I also have experienced housing instability, and this work, I think, means a lot to us on this team because of our own lived experiences, but also because we all believe in a community and a nation where folks have access all the time to safe and stable and permanent places to live. So thanks again for being with us today, and we'll be posting the webinar soon. Thanks, everyone.